morning.
Good morning.
Today we're going to do an evaluation. My patient is Jessica. She's a professional dancer and she's going to tell us what happened to her. She's going to speak in Spanish, tell me all about it in Spanish, and I'm going to translate it and help you to see the whole evaluation process that I'm going to do with her. Okay. Buen día. Gracias por estar aquí y por ayudarme a filmar esta evaluación, tratamiento, todo. Contame, ¿qué te ha pasado? So tell me what happened.
Me caí el lunes, me resbalé al salir de una oficina con un trapo y me caí sobre el antebrazo y aquí la pierna.
Yeah, espera un ratito. So she was going out from an office and she slipped and fell, and it was it was wet. The floor was wet, and she injured here her elbow and her buttocks. So we're going to evaluate and see what happened. ¿Qué es lo que te está doliendo? ¿Cómo te está doliendo?
Me empezó a doler el brazo, aquí, un poco a la altura del hombro también.
Yeah.
Y la pierna, siento un dolor en el aductor,
Yeah.
aquí que no me permite levantar la pierna normalmente.
Yeah. She has pain in her arm, in the back of her arm. She has in her adductor muscles are painful. It's not allowing her to do her movements. ¿Cuáles son los movimientos que te está costando hacer? Haz lo que acabas de hacer.
Mantener el brazo al lado,
Ya.
aquí me hace doler, y subir la pierna.
A ver, hazlo.
No puedo.
No puedes, okay?
I can't.
You can't, okay? So she's having a hard time putting her ballerina positions and also in her legs, and she is unable because there's something going on. So we're going to start. I'm going to first evaluate from the front. Okay. So what I see when I evaluate, I want to see symmetry. I want to see the direction of her head. I want to see if she is rotated. Here I'm going to check the level of her occiput. I'm checking her chin. Is it deviated? I'm going to check, what's going on her sternocleidomastoid muscle. I want to see, the levels of the clavicles. I'm going to check the shoulder levels, because that can give me a lot of information of all the structures that go from her heart to her head. So remember, you have muscles, you have arteries, veins, nerves that if they are stuck, there's an obstruction for the blood to be pumped to our head through the neck. We're going to have a problem. So it's very important at this point to evaluate with all the principles of osteopathy. The unity of the body. It's a whole body, so we have to evaluate the whole body. An intelligent body that is going to self-regulate itself. It was going to self-heal, but we have to, as osteopaths, we have to give them the conditions to be able to do that. The other principle is structure governs function, or vice versa. So it could be a position that if she's rotated is going to affect the function of her body. It can affect, the flow of the artery. It can, the vein won't be able to pump up the blood back to the heart. So The fourth principle, the rule of the artery is supreme. The artery, the vein, the lymph system, the nervous system has to be free from obstacles so that they can do their work correctly. Okay, so again, I check her head, her shoulders. I check, relax your arms. What I'm going to see here, I'm trying to see, you relax your arms. I'm seeing the space between her arms, okay? That will tell me if she's side bent, if she's rotated. I check at the level of her iliac crest. I check at her hips, her knees, and her ankles, okay? Now you can turn around. In the evaluation, and can you come a little bit further back, right there, right, perfect, perfect. When I evaluate the back, her back, I'm checking spinous process, transverse process, spinous process, and transverse process, okay? So what I'm checking is for any rotations. A rotation of a vertebra means when the spinous process is posterior, okay? And I'm going to check. So I'm finding, okay, here is, I can feel, is it tender?
Mm-hmm.
So it's tender for her. I'm going to put a mark. Okay. Oops, there's another one, but for learning purposes, I will keep these three. Actually, I have to mark it because it's very prominent. And I have to work on it. You fell hard. Te caíste fuerte. And then I'm going to check the PSIS and check again for a sacral sulcus is deep or shallow. So here I feel that her sacral sulcus is posterior, okay? And this here is deep. I'm going to show you, because in her body you can see it, but with another shot. Okay, so here it's posterior. This is shallow or deep. This is deep and this is shallow or posterior. So can you bend forward? Te puedes agachar. Okay, and did you see, and come up. Did you see how my finger went higher? So this is the forward flexion test. When I see it posterior, and when she flexes, ya no necesitas hacerlo, when she flexes forward and my thumb goes with it, goes up, that means it's a positive sign. So it could be a left on right torsion, or it could be a right on right. So I don't know yet. I have to do other exams. Then I go to her ILAs, inferior lateral angles, and checked their, so I'm seeing a lot of things. And this is the side that you, okay. And then I'm going to check her knees and her ankles. Okay, so come a little bit further there, okay, and I see the gluteal folds. I checked her knees, if they were in hyperextension, and also I'm seeing her feet, you know, I checked the Achilles tendon. So that would be an evaluation from the front and from the back. And now I'm going to do a little bit sideways. Okay, she's a ballerina. So, see, she's a ballerina, so she has a very good posture. She has nice curvature of her thoracic, cervical, and her lumbar. I check if the alignment of the ear with the shoulder, and she's doing good. Here I see a little bit that she's tilted. Landmarks that are important to see is, can you bring your head forward? Okay. The most prominent vertebra is C7. If you don't know if it's C7, C6, or T1, when I put my fingers on the spinous process and I move her down, the one that moves forward is C6, the one that doesn't move is C7, and the next one prominent is T1. And T1 already has a rib, so you can feel it, okay? The other, the spine of the scapula, if you follow the spine of the scapula, you have T3. The inferior border of the scapula is T7, okay? So those are nice landmarks that you can know where you are. Remember that from T1 to L2, you have your sympathetic system, okay? So, and remember T1 to T6, so see if this would be T7 to here, the sympathetic, it's the sympathetic for the heart. So something that you know. Lower you have, you know, your liver, your kidneys. So remember your dermatomes, that will give you a lot of information of what's going on, not only structurally, but also the nervous system, the circulatory system. Always keep in mind things that can happen. This could be a very mechanical problem, it can be a visceral problem, it can be a neurological problem. So continue in your mind to see what's going on so that we can treat the entire body, not only the physical aspect, but also the emotional aspect and the spiritual aspect, the whole thing. And all the systems, the musculoskeletal system, the circulatory system, the nervous system, the lymphatics, everything together. That's why it's very important to do a very good, thorough evaluation, not to We're not trying to come up with a diagnosis. We're trying to see where is it stuck, where is it not moving, trying to go to the cause of the problem and not treat the symptom. Okay?